Welcome to the Autism and I podcast with Miriam Jamal. Bienvenidos al Autismo y Yo con Miriam Jamal. I'm going to do a little disclaimer in Spanish and then I'm going to continue this in English, ¿ok? ¿Cómo están todos? Espero que estén bien. Sé que es un poco raro porque todos mis podcasts son en español, pero últimamente estoy encontrando a profesionales que son tan increíbles, pero solamente hablan inglés. Entonces lo que vamos a hacer es que lo vamos a entrevistar en inglés y voy a poner los subtítulos en español para que ustedes no se pierdan de esta gran información. Al igual que hay muchas personas que solamente hablan en inglés y no pueden tener acceso a ninguno de nuestros 84 podcasts porque no hablan el idioma. Entonces voy a empezar a mezclar de vez en cuando diferentes idiomas, pero siempre tratando de que los subtítulos ustedes los puedan leer. Así que hoy vamos a hablar con la doctora Efrat Lemandré, Dr. E with a PhD. Ella es increíble, pero los voy a hablar en inglés. Dr. E, welcome.
First of all, hola everybody, and I understood incredible, so thank you.
Really? You did? Un
Well,
poquito?
yeah, that was very nice. Thank you so much. I'm so excited to be here.
I'm so we're kindred spirits. Like we really are. I have been stalking you on TikTok for a long time. Everything that comes out of your mouth is truth. And I find many people in need in the United States, people who speak English, they need this information that you have. But I found very, very little amount of like healthcare professionals that I could actually tell me or, you know, are on the same train of thought as we are, who know the truth about health and how to get healthy. You know, everything today, and tell me if I'm wrong, but it's like, oh, you're sick, here's a pill for that. And yeah, and I think that we need to bring this information to people who are looking for it. What do you think about this? Oh, you're not well, here's a pill for that.
Well, before I even say that, I want to say, and the information that you have, we really need here in the States, and we need it everywhere. Because I'm, you know, you were on my podcast, and I know that everyone's going to love what you're doing as well. So yeah, you're right. There is an idea of a pill for every ill, and it's interesting. We were talking off camera about I'm in functional medicine. And to get into functional medicine, when you go to the Institute of Functional Medicine, you first have to have your degree. You first have to be a doctor, a nurse practitioner, a PA, chiropractor, because that's the criteria to get into that school. And so you have people there who have all been schooled a certain way, and we'll talk about that in a second. And we all go in there because something happened to us. So either we got sick or someone we love got sick. In my case, it was my wife. And then we realized that all the tools that we learned in school and everything, which good tools, but it wasn't enough. And so we go back into school, because what crazy person goes back to school after finishing all this school? Only people who are desperate, right?
1000%.
So you're in a room, like when we go to these conventions, of people who are in conventional medicine, and then they get converted and they have to learn more tools. And part of that tools is understanding the limitations in conventional medicine. So I want to take a moment, because I know you and I are on the same page when it comes to this also. I'm sorry, I'm just going to keep talking if that's okay.
No, I love it. Yes.
Okay.
Go.
So I think where you and I and so many people who are in our space agree, it's not an either or conversation. Like, we need conventional medicine, you know, we need surgeries, and we need antibiotics if we need to, and we need certain medications if we need interventions and radiology. And there's amazing life-saving things that are happening in conventional medicine. And it's kind of wonderful, especially if you have certain illnesses. But if you don't fit the algorithm, that is where the whole thing collapses. And it's an algorithm. It truly is an algorithm. What you learn in school is like, there's actually an app for all of it. Somebody has a strep throat, we have an app that we can go and say, okay, what's the next thing I do? It's truly an algorithm. And if someone doesn't fit that algorithm, often what happens is that we turn to the patient and say, there's something wrong with you, because
it's in your head. It's in your head.
It's in your head. Yes. It's in your head, which is why my first book is called It's Not in Your Head.
Oh, really? Oh my God.
It's in your head. Yeah. And so it's in your head. So before you and I spoke, and I know you're in the world of autism, and I can't wait to talk about that more. But like for me, I have people from all walks of life who, by the time they came to me, have already seen 15, 20 people who are very, very smart, amazing people, have nothing negative to say about these doctors. But every single time, patient said, I'm fatigued, I can't concentrate. My skin isn't okay. I'm in pain all the time, whatever. And they would do all the tests and they would say, there's nothing wrong with you. And so if there's nothing wrong with you, if the algorithm can't find anything wrong with you, the only conclusion has to be that you're crazy.
Yeah, 1000%.
So now you become crazier and crazier because now you have a file of all the CAT scans and the MRIs that you did and everything you did. Now you go to the next doctor and the file. And I'm going to tell you that when that doctor sees you walking in with that file, they've already registered you as crazy. Like that's, I know, I live this world. They judge you. You walk in and say, look, this is all the work I did. Please help me. In their mind, they go, you're crazy, or fibromyalgia, or
fake news. But you know
Fake
something?
news.
I'm sorry to interrupt you. There's something I really want you to, I want people to understand. So if there's something wrong with you, if you don't feel well, you go to the doctor, they do all this testing. If they don't find anything, they tell you you're nuts. With the autism population, we don't even get that grace. We, as soon as we have that diagnosis, that is enough for us to not even be considered for that algorithm. Our kids get tested for nothing. Our kids get no help. They get no file. They don't even get a long family history, like a clinical history. And so part of the problem why they get so sick in many different things is because there's no doctor willing to really even do one blood test on these kids.
Right, because everything's autism.
So then you are the crazy parent if you are asking for those tests. They're like, why? Your kid's autistic, just accept that. It's never going to be fixed. That's forever. And so you're the crazy nut parent when you go to these doctors and you're like, listen, I know there's something to be done and I don't want to just medicate my kid. I want you to help my kid, and you're the nut job with no file, no file, by the way.
That's true. But you know what's interesting now you're talking about this? Something to consider is the parents of this child. Like if that mom has issues and she goes to complain, she's going to be told, what do you expect? Your child, even her issues are going to be blamed on the autism. She's like, what do you expect? You're stressed. You're stressed out. Your child has special needs. We don't really need to do any testing. Would you like some Xanax?
Exactly. It's next to the candy bowl.
It's right next to the candy bowl. That's so funny. And you know, there's a lot. It's true. There's a lot of parallels. The reason I'm so drawn to what you do is because I'm not an expert in autism, but what I am is, and I have become an expert on the microbiome. I have become an expert in understanding that so many illnesses, unwellness that are either not treated or not acknowledged in conventional medicine have real answers. And I also truly understand the limitations of conventional medicine. I still practice conventional medicine. I have a primary care practice. We do all the primary care things. So it's not an either or concept, but when some patients need more, I'll give you an example of a patient in primary care. This is a mom of a special needs kid. And she came to me, she's like, he was head to toe with like rashes. And she's already been to the dermatologist, and she walked in with like all these creams. Wow. And she's like, I don't know what creams to use anymore. And so this is someone that I said to her, okay, hold on a second. This is not a primary care conversation anymore, because in primary care, that's it. Here's the referral for the dermatologist. Let's just find all the right creams. If you're lucky, God bless. If you're not, you're not. So I said to her, hang tight a second. Let's talk. It was almost lunchtime. I knew like the office was shutting down. I took her and her son to the side and I said, I need you to know something. This is not a primary care conversation. This is out of the box thinking. I said, your son 100% has a microbiome issue and a food issue. And you're not going to find your answers with dermatology. Use the cream if it gives him some relief. You need specialized testing. And she went on her own way because I didn't take her on as a client because I didn't take on pediatric for functional medicine. And I told her exactly what to do, what testing she needs to do. And the rash is gone. She's healed his microbiome. She changed the foods that he ate. But this was a conversation that she would never, ever have access to.
Yep.
From pediatrician. And, you know, again, I know that we talked earlier, so I'm talking about skin, but the gut and the skin, the gut and the brain, the gut and your joints. So if you have autoimmune issues, thyroid issues, rheumatoid arthritis, Alzheimer's, Parkinson's, MS. These are all manifestations of a bigger problem. And when we go to conventional medicine, we get treated for the manifestation, right? And it's super clear. If I talk to you about diabetes, it's very clear. If I say to you, hey, you have diabetes, you're eating too much sugar, and I'm going to give you medicine, it's very clear to you that the root cause is if I just stop eating the sugar, I won't need this medicine. Super clear. We could see that. But for some reason, every other disease, it's like it goes away. Like we don't think like that. If I tell you if you have a thyroid issue, you probably have a gluten issue. No, that doesn't make sense. I just suddenly need thyroid medication, right? So we just don't work on root cause analysis on anything else. Let me just shut up for a second so you can ask me a question.
No, I'm just like, I don't even to ask you anything. I'm just like this. Because
that's how I was when you were on my show. I'm like, yes.
I'm like, just talk. Like you're preaching to the choir. It's something that I've been trying to explain to people. That when it comes to autism, yes, okay, it's known as a condition for life. So it doesn't mean that they're not human beings, that there's a lot of medical issues going on with these kids that manifest in behaviors that then doctors want to give a pill, a risperidol pill, or just go to conventional medicine, not medicine, conventional therapies or ABA or, things that, so your kid's not feeling well. You're doping him up with something and they're asking him to do well in therapy. And then he gets frustrated and he gets all, aggressive in therapy and no, therapy's not working, but he's not feeling good. And so the microbiome is something that it's considered an organ since 2010. And one of my biggest problems is that how can a doctor not know what that is today, 2024? It's been an organ for 14 years, at least in, conventional science. They're not even teaching this in school. And so you said something really important. You said, well, this mom would not have had access to this conversation if it were not for like that fluke that she came to see me. But people have to have access to this conversation. So I really want to go to basics.
Okay.
For people who have never understood this, what is the microbiome and how does it affect the body?
Okay, love this question. So the microbiome we think it's just the gut, but it's not just the gut. Think, first of all, it's everywhere from your mouth to your anus.
Yep.
But it also exists in your lungs. It also exists in your bladder. So just think of it microbiome. Bio means world, micro means small. It's a small world of bacteria, viruses, fungi, protozoa, parasites that all live inside of you. Now, if you're like, ew, that sounds gross, I'm going to tell you this. Not only is it not gross, you can't function without it. So these biomes, these bugs that live inside of you, they don't just live inside of you and catch a ride. They live inside of you and do the work so that you can stay alive. Without your microbiome, you could not be alive. It's not possible to be alive without it. And it starts from like when you're in utero, as soon as you come out from the vaginal canal. Vaginal canal is a certain amount of bacteria, different if you get C-section, different. I'm not saying better or worse, but different. You get more when you're breastfed. You get more if you're bottle fed. You get more as you crawl on the floor. If you have a pet, the more dirt you touch, you're constantly getting more. And you are constantly adding citizens and residents into this microbiome, some good, some bad. And there needs to be a very healthy, diverse population in your system. In fact, there is more of them than there is you. Like if I took the human cells and counted them and the microbiome, all the people in the microbiome, not people, but you know what I mean? There's more of them than there is human. It's just that the human cells are bigger, so we look human. But if we
DNA,
counted them,
did you know that that's the exact number though? I could
no,
tell
I don't know
you.
the count.
23,000 human genes, DNA genes, like when we're talking about genes, versus 3 billion bacterial genes.
Yep. There's just more. It's just, you're not really human. You're really more bacteria.
Yes.
Yes. And so you need this. So what do I mean when I say you need this? I mean, technically, these bacteria do jobs. They're your factory workers. And they produce serotonin, which is, right, if you might not be sure exactly what I'm talking about, but if we're talking about mental health, you may have heard the word serotonin, you may have heard the word dopamine. It's managed there. So anytime we're talking about mental health, we're talking about your belly. It produces something called short-chain fatty acids. Short-chain fatty acids, I want you to think of it almost like the building blocks for just about every chemical reaction you need in your body. It produces certain vitamins. It produces things for you to stay alive. It doesn't just digest foods, although you need it also to digest foods. So in order to function properly, for your mental health to be on point, for your skin to be on point, for everything to be on point, you need to have a really robust, diverse, highly populated, and a good balance between good and bad. That's what the microbiome is. As soon as that microbiome is off, you will notice things go wrong in your body. So if your main factory has a broken part in it, what it produces down the line is not going to be good quality. So in each person, it's going to affect something else. This is why sometimes it feels like, oh, I'm on social media, everyone's talking about the gut. How could it be that the gut is, this is what the doctors will say. Oh yeah, you go gluten-free, it's going to fix your thyroid, and it's going to fix your rheumatoid arthritis, and it's going to fix your psoriasis. Yes. Yes, it is, because the problem is in the factory, and it's just producing issues in your body. So this is how illness comes. You have a genetic predisposition. So there are different kinds of genes. There's genes that are like brown eyes or green eyes. Those are there. And then there's genes that get turned on or off depending on our environment. So you have a genetic predisposition. Grandma has hypothyroid. Somebody in the family has Alzheimer's. You're born with that. Like maybe that will turn on. And then you have something that happens in your life. What are you exposed to in your life? And then oftentimes there's also a trigger. So what do I mean by that? I have this, predisposition for, I'll just say thyroid. It's in my genes. And I eat standard American diet. So that's kind of lifestyle. Maybe smoking cigarettes, whatever. Like my lifestyle's not great. So my microbiome is going to shift. It's not going to be great, but I'm going to chug along. I'm not going to have thyroid issues in my 20s. I'm not going to have thyroid issues in my 30s. But then a triggering event happens. You had COVID. You had flu. You got into a car accident, got a concussion. You went somewhere and you got a stomach virus. Something happened where you're going to now say, ever since this, I have not been the same. And that's a triggering event, but it's not actually the cause. It's just the thing that pushed you over the edge. All of it had to do with how bad your microbiome is, because the other person with the flu or the COVID and the car accident is fine because their microbiome before it happened. So just to kind of recap that, genetic, lifestyle, trigger, illness. So now I'm going to take a medication just for the illness. But what about the trigger? What about the lifestyle? How did we get here? So
what? I mean, how could it be that not every medicine looks at this? Why?
Because, okay, this sounds horrible, but ultimately the system is created around money,
yeah,
finances, pharmaceuticals, insurance. So what do I mean by that? I'm not a conspiracy theorist.
No,
I really am not. This is just a certain reality. So I'm going to give you two realities. And I imagine this works similarly in different countries. We just have maybe different insurance plans. But part one of the problem is, let's talk about insurance plans, and then we'll talk about pharmaceuticals and studies and research. Part one of insurance, when you go into a medical visit, there are certain expectations on your documentation. What is the diagnosis code? How complex is that? And we get reimbursed accordingly. So even if you're a country that doesn't have insurance the way America does, I know enough about insurances to know that we all use the same ICD-10 codes. Mm-hmm. And I know that every country uses these ICD-10 codes to manage population health. How many of our people have diabetes? These are all codes that are used. There are international codes. And so the entire visit revolves around finding codes, finding chronic illness, finding issues. If you come in and just say to me, I don't feel so good, and there's nothing there, I can't document anything. Like, what am I doing? There's nothing around. There's no next steps around it. The whole system is built around illness. There are no codes for wellness. You don't get reimbursed for your time for spending time talking about longevity or wellness. And there's no malice or prevention. And it's not because the doctors are mean. It's just not designed. It's designed to code the illness, manage the illness. So you have an entire system that revolves around illness. Imagine a system that revolves around wellness. Imagine a system that's like, oh, look how many of your patients have no, like the absence of, we'll pay you more if there doesn't exist. We don't have that. We do get paid more if our chronic illnesses are improving, but we don't get paid more
for preventing it.
for preventing it to begin with. So it's the system itself is designed to be illness centric. That's part one. Part two is research. So I love to give this example. A lot of my kids that come into my primary care office have eczema. And I tell the moms, do me a favor, just take 30 days, no milk, no dairy, just 30 days. Just give it a try. If it doesn't work, it doesn't work. No side effects, no nothing. 99.9% of the time, I take them off dairy, eczema goes away. It's not an allergy. Their food allergies are negative. Their dermatologist told them that I'm crazy. And I warned them, like, your dermatologist is going to tell me I'm crazy. Just try it. So now, who is going to fund the study on the absence of milk for eczema? There's no shekels, there's no pesos, there's no dollars here. Right? So you can't fund the study. Is the milk company going to fund it? Like, you're talking about an absence of, like, there's no funding for the study. So sometimes you find small scale studies, maybe privately funded. But I recently had on my podcast someone like the guru for Alzheimer's. I think you're the guru for autism. He's the guru for Alzheimer's, Dr. Bredesen. And he also, MD, also, kind of came to this world. And he has come up with a protocol of how to reduce, reverse, prevent Alzheimer's.
Wow.
But it's many, many steps, just like your protocol. You have to be on point with your diet. Because it's a certain age, you have to be with your hormones and, ketosis and all these things. And so he said he can't get funding because the only way to get funding is if it's one variable, one intervention. And he's like, it's not one intervention. It's a series of interventions. And with your story that, in fact, one intervention is definitely not the way to go, because if all the other things aren't in place, it doesn't work. So he cannot get funding. And he said this to me, and I think you would resonate with this too. He said, look, I will tell any neurologist in the world, bring all the people into a room that you cured from Alzheimer's, and I'll bring all the people in the world that I cured from Alzheimer's, and let's see how many people we bring. So, and that's the answer, because in neurology, it's just medication. And I think you also, maybe not the word cure, but how many people have improved from autism?
Oh, yeah.
Using your protocol
versus neurologist.
How many?
For sure. But here's the thing. What's really great about autism is that they come with parents. And we are not in the business of just taking it laying down. Right. We're not doctors. We're parents. And when you became this, functional medicine, guru as well, because like you not only just practice it, you preach it and you help other people through your, videos, but you did it for somebody you love.
Yes.
And so whenever we're going to do something for somebody we love, it will be done. It will be done. And so I find doctors are like-minded. I find protocols. I find diets. I find anything that my child needs so that her diagnosis does not become her prognosis. So even if not one person is going to be able to change the system, okay, but it's going to be very hard to change this system. It's already been set in place. Now, right, but I can change my system.
Correct.
I can change what I do in my home. I can change what I do with my daughter. I can change what I communicate. And somebody else can change their own world and what they eat and what they do. And so my job isn't to change the whole world. I would be very tired.
Already tired.
Yeah, I'm already tired. But the thing is, like, I just want to be able to educate in a way that people understand. And so the microbiome is a thing that there's not one day that goes by that I don't say the word. Like, people don't want to invite me to dinner anymore. I have like no friends left because they're sick of me. Everything about me, I need to educate every moment. Like, they're like, just shut up. Like, we don't care about the microbiome today. And then I'll make a conscious decision. Okay, I'm going to go to dinner. I'm not going to talk about it. But then the waitress will recognize me and she'll say, oh my God, I saw your podcast on microbiome. I'm like, I know, right? So bottom line, I think that most doctors, by the way, that are in my world, they actually have autistic children, most of them. And they had to find something more. And I think it's ironic that what that more thing is the cause.
Yeah.
I mean,
I mean,
come on.
I'm telling you, in this world, so now in the first few seasons of my podcast was just me educating the public. In this most recent season, what I do now is I interview other medical disruptors, and every single one comes and says, well, this happened to my husband or my wife or my child, and I couldn't take it anymore. So you are so right. And that's almost the only way you're willing to take, this is from medical people, to consider that you've been blind. Right? I'm writing my second book now about medical gaslighting, and I call myself a recovering medical gaslighter because I never did it with malice. And I try to teach my colleagues when I speak, there was no malice. I really thought I was doing the right thing for years. If you came to me and said, I'm just not feeling right, I'm like, oh, Mrs. Smith, let's run all the tests. And then all the tests would come back. I really thought I was doing the right thing. I was like, okay, look, there's nothing here. And then I would say, since there's nothing here, this must be anxiety. It must be anxiety. And I said it with love. And I was like, let's manage this anxiety because it must be, right? There's no other conclusion. And I went down this rabbit hole with my wife. My wife had 2 autoimmune issues. The first one was called PMLE, and I'm mentioning it because you never know your audience how it.
Yeah,
PMLE,
of course.
polymorphous light eruption, which basically is an allergy to the sun.
Oh
So
my
no
God.
sun. Yeah.
Really?
And her first career was a Division I coach. So she was outside all the time. And she started getting sick and sick and sick, and they thought she had lupus. And it took her 3 years to get finally diagnosed. But every time she went in the sun, 2 or 3 days later, she would be out of commission, head to toe rash, flu-like symptoms. But because it was like a delayed reaction, it took a really long time to figure it out. So when I met her, she already left that. She just she came to terms with it. She's like, this is my life. She left that career. She went into medicine. That we met in the ER. But then she developed a second autoimmune, which was severe psoriasis. I mean, so severe that like she couldn't button her shirts because they would just bleed. She couldn't walk. Her shoes would bleed. It was a mess. This was before the internet is what it is now. And so I was like, it just can't be. It just can't be. And she was resigned to it. And she's in medicine. I'm in medicine. All our friends are in medicine. Like, we have everything at our disposal. We can go anywhere, right? Which is crazy when you think about it. And I remember talking to someone, a chiropractor, and he's like, did you hear of functional medicine? I'm like, no, sounds nonsense. This is going to be nonsense. But I had nothing to lose.
Yeah.
So we went to this guy, and he had this crazy idea that it has to do with her food. Now, my wife didn't eat standard American diet. She's a size 0 vegan at the time. Healthy, for those who are not watching us, air quotes.
Right.
Super healthy. You know, you look at her, athletic, eating vegetables all day, but also eating a lot of corn and soy because she was vegan.
Right.
Which is not a bad thing for people, but for her, it turns out gluten, corn, and soy, we did special testing, was her enemy. She had to completely change her diet. And I mean, within 48 hours, her rash was like, we were taking pictures. We were not believing the rash just getting smaller and smaller and smaller and smaller. And then we would go outside and she's like, I don't like, because she knows if she's too much sun, I don't feel it. I don't feel it. And now all of a sudden, like, we would go out 5 minutes, 10 minutes, and now we're normal. Like, we could go anywhere now. We couldn't leave, like after 4 is when we would leave the house. So I was like, what? This is magic. Now, I did the diet with her because I'm a good wife.
Yeah, yeah.
And I started feeling so good. And I was like, wait a minute. I didn't even know I felt bad before. I didn't know that you're not supposed to be bloated after every meal. Yeah. I didn't know my joints weren't supposed to hurt. Like, this was just my natural progression. So then I was like, oh my God, I feel so good. There's something here. And I took one course, another course, another course. And then before you know it, you're in the vortex. and then you realize that everything you've been saying is nonsense. So now I know if someone tells me that they don't feel well, Of course, I still do the labs. And if I find nothing, I say to them, okay, this tool here cannot find anything. Now it's time for you to look to the left, look to the right. Is it mold? That's not conventional. Is it your microbiome? Is it Lyme? Like, there are other worlds and other tests and other options that don't exist here. So now I could say this is one tool. Before, I thought it was the only tool.
Yeah, I understand completely. I'm going crazy because I love this example. And in that moment when they tell you to change the food, right? Like, were you super skeptical?
Super skeptical. I was like, this is nonsense. Because we never learned that nutrition and skin. This is like 2011. What nonsense are you talking about? Now everyone's like, yeah, psoriasis, gut, but like, I just did it because why not? There's no side effects. It's not a medication. Like, let's just try it. Like, it was like we had nothing to lose. Let's just do it. And we sat there with our stupid Tupperware eating the same thing. And I was like, I was lucky it was a rash because we took
You could
pictures and
see
we could just see it. And it was magical. But I really did it with complete disbelief. Like, this is
and,
not going to work.
yeah, and when you went to do the whole functional medicine and you start to look deeper and deeper and deeper, was it something just so amazing? Like you said, like I was blind and now I see, and now I have to educate because the whole world needs to know this is true.
So it goes like this, and a lot of my colleagues will say the same thing. I was blind and now I see, but now I'm scared. So if you ever look back on like my first videos, I didn't say what I'm saying right now. I would talk about water and I would maybe talk a little bit about gluten. I was scared because there's fear, and you'll hear this in a lot of my podcasts. There is a fear of going against the grain. People have lost friends, people lose respect from the community. People start calling you quack, and you have to get over that. And you have to wonder, is this going to affect me financially? Does it have food on the table? And you're coming from a world where you've been taught that people who sound like me and you are crazy.
Yeah.
So you have to suddenly realign your identity with some of the crazy people. There is a transition. There's a transition period. And, one of the pediatricians I talked to on my podcast, she says, she went to all the schools to become a pediatrician. She graduated to find out that she said, I'm a fancy pharma rep. That's what she felt she was as a pediatrician. But she
1000%.
said, yeah, but then as her husband got MS, which was the reason why she went back to this, she said she lost all of her friends because she's crazy. Like, so there's a transition. And then at some point, like, it clicks for you and you're like, F it. Okay, I'm crazy. Because as you start helping more and more people, and people are like, thank you for listening, tears in their eyes. No one ever took me seriously. It's the first time I feel better, and all these things. You're like, I remember coming home every day to my wife. I'm like, this is working. This is working. Oh my God, this is working. This is like, I'm changing lives. Like, you don't believe it yourself. And then eventually, like, okay, so I'm a quack. It's fine. It's fine.
You know that I'm actively going to try to change that with everything we're going to be doing with the documentary. Like, we're going to try to actively change. But, I appreciate what you're telling me, because I never actually, as a parent, when you see a doctor, you see somebody superior. And I would never think of a person as a quack who is actually taking me on seriously and showing me a way. A parent wouldn't, but I could definitely see how another doctor would judge it, right?
Oh my
Especially if you're
God,
going against the
yes.
norm. As a parent, you will go against the norm 1,000% of the time if it means your child gets better. And the moment you get better, like you see your baby better, you will never turn back, and it will not be painful. It's something like, listen, it's a little harder
Correct.
because I have to like really like go against, the like we're salmon, we're going against
Upstream.
right, we're going
Upstream.
right. The more of us that there are, the easier the current gets. When it comes to me to communicate these things, like I was just telling you the other day how hard it was that I went to this conference that I was invited, and most people were against what I was saying because they were just saying this is the condition, and it should just be this way. You should be proud of what it is. I'm like, it has nothing to do with an identity. It has to do with my daughter not being well or being well. And so they walked out of my conference because they thought autism was just an identity. And I'm like
Right.
saying, no, you're human before you're anything else. And I know that we're in the right moment in time to help people do better. And so I had to come to terms with that. I'm up there and they're leaving, and they're leaving me. They're leaving me in the middle of a stage, 7 people in front of me,
Oh my God, that's
and
so rough.
they're boycotting what I'm saying. And I'm thinking to myself, okay, if I just for 1 second took my ego out of this, those 7 people need what I'm saying, and
Correct.
it has to be enough. And so, like you said yesterday to me in our podcast, you say, I stopped fighting. And that is such an important place to be.
Yeah.
To just say, fuck it. Fuck it. Like, I am not fighting anymore with anybody. This is truth.
This
And
is truth. Come or don't come.
come or don't
It's
come.
fine.
And you know who needs truth? Whoever is getting diagnosed with autism and is being told, like I was told, your child will never be independent. Your child will
Right.
never speak. Your child will never
Right.
get married. Your child's not going to go to college. Your child will always be in a special needs school. You know what? My daughter wants a boyfriend now. My daughter is looking
Amazing.
at colleges. My daughter has a shadow that helps her with different adequation. I don't know how to say equation. It's like when you take the material and you make it easier for somebody to digest.
Okay.
But she is freaking independent. And so
Yeah.
to me, it's like she is so much more than what they told me she would be. And people, for example, I had a best friend, and she is no longer with us, unfortunately.
I'm so
She was
sorry.
diagnosed with fibromyalgia, and she couldn't take it. And you can sort of guess what happened with her. And so now, so many years later, I thought to myself, why didn't I have these tools when I could have helped her, saved her from her fate?
Yeah.
And she must have been so sick. And all they said was, you have fibromyalgia. Every time somebody says that diagnosis, I think to myself, that doctor's a quack, because that doctor who gave you that diagnosis did not look for the cause. They just have no idea what the hell you do have. And I can
You
say
know,
that because I'm a mom. I don't have to, you know what I mean?
it's so funny. One of the most controversial videos I've ever done on TikTok was about fibromyalgia. And what I said was, this is very similar to what happened to you with the autism conference. I said, fibromyalgia is not an acceptable diagnosis. My next sentence was, that doesn't mean your symptoms aren't real. Of course they're real, but that's not an acceptable diagnosis. I got, a lot of support, but so much hate. How could you say that? You don't even know what pain is. First of all, yes, I do. But second of all, I'm on your side, wacko. I'm on your side. I'm trying to tell you there's more. Like, fibromyalgia doesn't mean anything. It just means the fibers and your muscles, myo, our algia, our pain. It's a description. Where's the root cause? Because the list of things that you get, including antidepressant medications, muscle relaxer, pain relief. So what, you have a deficiency in antidepressant, you have a deficiency. Like, this doesn't make sense. Where's the root cause? A lot of these people, so many are really mold sensitive. So many have chronic Lyme. Both of these diagnoses are not recognized in conventional medicine, but they're quantifiable. There's a test that can be done.
1000%.
And of course, all of them all have messed up microbiomes, because that's why they're more susceptible to these two things. But so if we can get to the root cause and take your pain away, or at least get you to a place where you can control and modulate the pain. I have patients, like, they get to a place where they're pain-free, and now maybe they want to have like a weekend and they're enjoying a little bit more of their food or whatever, but they're aware, they're in control of, okay, I'm going to pull back now, or I really want to, getting control over your pain is also amazing.
Yeah.
So,
but you know what? I understand them. Do you know, here's the thing I've come to know. When I get a lot of pushback, of parents or saying, no, the food has nothing to do with it, or my doctor said it had nothing to do with it, and they're like specifically hateful, you know what I realized? And this might not be true for everybody, but I think it's true for some people. These people who pushed back against what you were saying are people who've accepted their fate because they are tired.
that's true.
They have looked and looked and looked, and they have found no answer. So it comes to a point in which the brain says, accept it. If you accept it, if you stop resisting your reality, you are going to be in less pain. Because even if your body's still bad, your mind is not going to hurt more. And so when you actually give them a little bit of hope, a little bit, they repel against it, because that means non-acceptance in their mind. And that's going to hurt them all over again. And I have a lot of empathy for these people.
That is true, especially for some of them. They've already been through so much before they get the diagnosis of fibromyalgia. So when they feel that they get that diagnosis, they're like, oh, I have a
something.
thing. I am not crazy. And it's a very fancy sounding name. And so you're right. So there's a thing of like, no, it feels legitimizing. And I agree. And I'm double down on legitimizing them even more, but you're right when you say that. Like for some people, that's enough. They've already done the quest and they're exhausted and they're in pain and they don't want anymore. And I totally respect it, but it is very interesting perspective, and where people land on this spectrum. But that's okay. I was like, okay, so then this is not for you. Like if you're happy that's great. And for your conference, if you're happy with that, God bless them. They're obviously also very high functioning autism people if they're in a conference.
Oh yeah,
Right.
They
They didn't
were.
experience what your daughter experienced at 5, which was nonverbal and struggling with the entire world.
Well, you know what? I did get to speak to a couple of these high functioning autistic people before they threw tomatoes at me. And, they said, yeah, for some reason, every time I eat this kind of food and I throw it up, I just throw it up. So I can't even look at it. But because, I'm sensitive, my sensory input is different than the world's. And so that's why I throw it up. And I'm thinking, oh my God, it's not normal to throw food up. And
Nothing
so
normal.
there's some people that will want our fight and some who won't. And to me, it's like my job and your job is to give the information. Now I do
That's
learn
it.
empathy and sometimes my videos they used to be very harsh. And now it's like, listen, you want to change your child's food. And I know it's hard. And I'm so sorry, but it's possible. It's possible. And here's how I'm going to help you do that. And so I have over 84 podcasts, which I've done of so many different topics, so many different doctors and coaches and parents and testimonies and psychologists and psychiatrists and neurologists, always with the end game of educating this new era of medicine, which is about precision medicine. It's not about quack medicine. It's not about shaman medicine. It's not about let's just sit and pray. It's about, okay, precision. It's using conventional therapy. It's using everything that exists in the
All
medical
science.
world.
All science.
Everything. And the thing is, there's so much science. There's so much science. And if there's people who just don't know how to find it. So here's a tool for you guys. Even if you have fibromyalgia, MS, anything you have, what I tell people to do is go to ChatGPT and ask ChatGPT and say, ChatGPT, give me 100 scientific articles that link the microbiome to autism. And just let ChatGPT show you, and then give me the links. And you know what you can do too? You can say, ChatGPT, I want you to give me a resumed, like cliff note of the findings of this study as if I was a 5-year-old. So you can get these things that are so complex that not every mind can understand them, and get it really easy so that you can understand and actually do something with it. So I do want to go to the food because I think that
let's go.
Because something I don't want to let go before you leave. And I know you're so busy, but
no, okay, I'm here for you.
9 out of 10 doctors, and I've quantified this, will tell my patients food has nothing to do with it.
It's nothing to do with it.
Okay.
Nothing to do with your psoriasis, nothing to do with your eczema, nothing to do with your mental health, nothing to do with your fatigue. There's nothing to do with anything. Eat whatever you want.
Right. They're like, give your child pizza and bread. I had one kid who was eating white bread for 8 months.
Sure.
And he went to 2 professionals. One doctor that said, listen, it's because your child's autistic and he just simply is not going to be able to eat anything else. And the nutritionist said, oh, well, that's his safe food, because he looks at it as safe. She was right, because he was in so much pain that when he saw something soft and white, he thought, well, that's not going to hurt me, but it was making him sicker and sicker. And so, this person came to our protocol. The child ended up eating everything under the sun when we were done: vegetables, fruits, all fresh produce, everything. And so bottom line is, how important is food to microbiome, overall health, and behaviors?
I can't even answer that question, because anything I say is not going to be enough of an exaggeration of how important it is. So any words that come out of my mouth is going to be not enough.
Okay.
So food, I want us to stop thinking of food as food. I want you to start thinking of food as a code, a computer code. Because ultimately, everything you eat, whether it's a spinach or a French fry, right, gets broken down and broken down and broken down to the molecules. And those molecules, those atoms, those strands of DNA, depending on what you're eating, they are a code, a computer code. So what code are you putting into your body? Because everything breaks down to code. Are you putting in a code that's going to talk to the bacteria in your belly and say that, first of all, is going to feed the bacteria, the good bacteria, because they're like fish in your belly. So what kind of fish food are you going to give it? Are you going to give it like fish food for the bad guys or fish food for the good guys? So is it first of all going to feed the good guys, the ones that are producing your serotonin for your health, the ones that are producing short chain fatty acids, they're producing the surface oils that you need for your skin? Are you going to feed those bacteria? Or are you going to, first of all, feed the bacteria that are going to cause distension in your belly and inflammation in your belly? So and sometimes we know now there's such a increase in colon cancer that the foods we eat are actually creating carcinogens in our belly. So which bacteria are you going to eat? Are you going to feed? And then are you equipping, since we said about a half hour ago that these bacteria are our factory workers, are we equipping them with the code that they need to produce the tools? So guaranteed, pizza doesn't break down into that code. It just doesn't break down into that code. Spinach is going to break down into that code, right? And this brings us to, why are we taking supplements? Supplements is basically code in a pill form. It's going to take this B12 in a pill form. But if I can get my B12 as part of a code in, spinach or meats or beets, then how much better? Now that's just the code. And then the fiber itself of fruits and vegetables, the fiber that you can't get in a supplement, is an integral part of detoxification. Like not just fiber to poop, because that's what we think of detox, but the way it breaks down biochemically, it is necessary for the pathways. I just want to say what detoxification means. Detoxification means that you have a lot of stuff in your body, and when it's bad, it's packed in fat. It's called fat soluble. And detoxification, and when we get it out of the body, it's water soluble. Poop and urine is water based. The transition from something that's fat based to water based is the process of detoxification. And that is a chemical reaction that requires a lot of code, but also requires fiber. So if you're eating pizza all the time, you're also not getting fiber. You're never detoxifying. There's so much happening in that belly, in that microbiome, that you need real food. The code needs to be good. It shouldn't be, genetically engineered by big agriculture. It should be good code. And that is literally the only way to activate your factory appropriately.
If you add that especially in autism, some kids, even if they're eating good food, they don't have that computer that can actually read the code. That's why, for example, I give my daughter an egg and she starts flapping her hands like crazy and running everywhere. So we have a lot of things. What happens in the body when, let's say it's good food somebody's eating and they're reacting negatively to it? What's going on in that system that's not allowing them to go through that detox process?
Well, that's not necessarily a detox process, but I think there's probably several answers to that question, right? There's several answers to the question. For some people, so in cases like I think with your daughter, it was very clear that she just didn't have the diverse workforce in her belly. Her microbiome was so diminished that she couldn't really digest certain things. She didn't have the workforce to come in and break certain things apart. So there's that. But the other part is that for some people who have belly issues, we have something called leaky gut, right? And so leaky gut, really oversimplification, our body, our gut kind of goes in and out like this all the time. It lets certain things in, certain things out. It does its job. On a molecular level, you don't see this on endoscopy. And its job is to only let the good things like kind of through the holes and keep the bad things in the GI tract to go into the toilet bowl. And people whose bellies are a mess, it kind of stays open. And so now certain proteins, like the egg protein, are going to go into the system that's not supposed to. And so you're going to have a systemic response to something. The body's going to be like, what is this foreign protein? This is not a self protein. This is not a good protein. And it starts to create a reaction. And it could also then create a neurological reaction in the form of flapping, because it's not just staying in the belly, it's systemic. And leaky gut can it could be healthy foods. Think about my wife. My wife was a healthy eater. Corn is not inherently bad. Soy is not inherently bad. Certainly the quantities we eat are, but it's not inherently bad. Even gluten is not inherently bad. There's plenty of people who are fine with gluten. But when it's a system issue and it's overload and it goes in and your body now creates a immune response to it, it will show up in skin, neuro, which is the flapping, brain fog. I have people who have balance issues, who I've been to neurologist, really cannot balance. And you take them off of gluten and their balance is restored. Because for them, the systemic issue shows up in neuroinflammation. People who say to me, I used to be able to read in the car and now I can't even look down at my phone. I'm going to vomit. I have such motion sickness. Take them off of gluten, the brain calms down. So that has to do with, a systemic response to food, even if it's healthy.
Yeah.
So again, I can't stress it enough.
Yeah, to me, it's like a lot of the kids that come to the protocol, they have leaky gut and they're actually getting high off their foods because these kids usually laugh out loud for no reason, right? And parents are like, I wonder what he's thinking. No, he's not. He's drunk because you gave him a pizza or because you gave him a milkshake.
Yes.
Usually the three foods that we find is, gluten, dairy, and sugar are the ones that are going to release that dopamine and that morphine in the brain because of leaky gut. And so they're high and they're not even feeling their bodies like the same way another person would, in such a manner that my daughter broke her collarbone and she didn't even cry when she was younger. And there's a lot of kids who love the pool. I don't know if you know this about autistic kids, but there's a lot of kids who they could be in the water hours. And I was reading a book that an autistic person wrote and it made so much sense because he said, when I'm outside the water, I don't feel my body the same way. When I'm inside, I finally feel myself. And I believe it has a lot to do with this leaky gut and how this morphine is going through the body, this dopamine, and they just don't feel their bodies the same way. And the first thing we see when we put them on a special anti-inflammatory diet, even before they come to Panama, they start to feel pain. Like if they fall, they cry like any baby would. Or if they're teething, they're uncomfortable. So I think the food is so important and people just don't give it, it's everything to start.
It's everything to start. It's not. You're right. You're right. You want to say something before I continue about everything to start? The other reason probably these kids are crying, not only are they feeling pain, but I know this because my adult patients have verbalized this, they are withdrawing from the drug.
Yeah, it's an abstinence syndrome, of course.
And they're in so much pain in the beginning. I mean, some of my adults who are most addicted to this food, in the first 2 weeks, they hate me. And I'm like, just push through this. But it's a true detox. So these kids that are experiencing pain, they're actually agonized, some of them, in the first few weeks. So you have to push through it. But you're right. The other point is it is just a starting point. And so I don't want to, as complex as it is, I also don't want to oversimplify, and I know you know this, to be like, okay, just go gluten-free and everything gets better. No, it is the foundation upon which other things can happen. Like in your protocol, it's a stem cell, it's the MERT. And so for some of my patients, I'm not even going to talk to you about mold detox. If you can't, how am I going to detox you from mold if your belly's a mess? How are we going to manage these supplements if your belly's a mess?
Your microbiome is who detoxes.
Right.
That's why, when I know a doctor doesn't know shit, when the first test they do,
they don't know shit about this topic.
About what I'm about to say, is when the first test they do is heavy metals. When in the autism world, may I rephrase, in the autism world, when a doctor, the first test they give you is a $400 heavy metal test. I'm like, wait a minute. Yes, they're going to have heavy metals. Well, obviously, because they can't detox them because their microbiome is shot. So,
but how are you going to chelate this child?
You can't.
You can't.
As some people are doing, it's very dangerous. But bottom line, if that kid's eating pizza all day or chicken nuggets all day or fast food all day, you're doing nothing with these heavy metals. There's no magic wand to chelate a child.
Right.
It's ridiculous. And so to me, it's like, I want people to understand that the food is the basis of everything else that you're going to do. And now there are some lucky people. I've seen lucky people who they take away gluten and dairy, kid starts talking.
Correct. The same thing with adults. I have some people that's all I need to do. I do the dietary intervention, they never felt better. I'm like, great, I'm a magician. most of the time it's not the case,
Right.
but sometimes it's that simple, which is great.
Why do you think gluten and dairy and sugar particularly are sort of these three universal foods that are most of our bodies just either can't digest or get hurt by these things?
I think it's the overload. I think we were never designed to have this. I mean, think about like 2 or 3 generations ago. If you wanted to have a cookie, you needed to bake it. You needed to stop everything, you baked it, and then you ran out until your mom, your grandma decided to bake it again. It's just overload. We're not designed, and it's overload in the cookie. It's in our ketchup, like high fructose corn syrup. It's like packed everywhere. And our food, along with all our chemicals, but let's just stay with food, has evolved much faster than our body has evolved to process it. So we have these really highly refined sugars, highly refined starches, highly refined, all packed. Every little morsel is packed with so much. You know, people say, how could fructose be bad? It's in a fruit. Right. In an apple is never going to be as much as like 1 teaspoon of your high fructose corn syrup. It's overload. And I just don't think we are designed to be able to process all this. And then the system just breaks down. That and a world that has really become too sterile. So we don't develop the microbiome we need. Don't touch that. Let me wipe your hands. Let me
After COVID, it was a problem as well.
Yeah, I have to go. But like this whole, I would say in the last, 10, 15 years, this generation of kids is like antibacterial, is like they're carrying it in their backpack.
Yeah.
So
and these bacteria are not always bad.
They're not always bad. Exactly right.
You know, I'm gonna take advantage that I have you here. I'm gonna tell everybody listening to this: if you live in the United States of America and you're being told by the doctor that you don't have parasites because in the U.S. there are no parasites, it's a lie.
It's a lie. Of course, it's a lie. They're everywhere. They also say that there's no such thing as chronic Lyme, and I just want to take a moment to talk about that.
There is Lyme. I've read about it.
So there's Lyme, and in conventional medicine, you're positive, you take 28 days of antibiotics, and then it's done, and you're not allowed to talk about it ever again. And if you still have symptoms, there is a code that says post-Lyme and like infectious syndrome. In other words, the Lyme is the Lyme is gone, and you have a syndrome. And that's as most and as far as you're going to get. But there will be no conversation of chronic Lyme, which means it's still active in your body because we gave you the antibiotics, so you're a little bit crazy. But we have labs that can actually test differently to show that you actually are still walking around with a chronic Lyme infection. Now, I'm bringing this up to your community because that could also present itself neurologically. So chronic Lyme issue, the testing that's done in conventional medicine tests kind of like the immune response to it. So if there's no immune response to it, there must not be Lyme. But for people who are already special needs or have other issues, they can't even mount a response to the Lyme. So the testing is wrong.
Yeah.
So so you're telling these people they're not Lyme, but they are, and you can come up into so many joint pain, neurological issues. So I know we can go on forever.
Lyme comes from a tick, right?
Lyme comes from a tick.
From a tick. So if you get bit by this tick and it has Lyme, you'll get it too. And there's a lot of people who are actually misdiagnosed with autism, which what they actually had was Lyme.
Yes.
I was hoping so much 10 years ago if that was my case because I was so scared and I read about Lyme and I'm like, please have Lyme. But no, it wasn't the case.
But there's also there's Lyme and there's other tick-borne diseases. And ticks travel everywhere. And the idea of, listen, the minute there's airplanes, the idea of regionality is gone.
Yeah.
It's gone. So if I have a tick, like it's just gone. Like it could be anywhere. Like I'm sure, of course, there's pockets where things are more likely. But to say that something doesn't exist, and it's just crazy.
Wow. I could talk to you for hours on
okay, we should let your audience go.
No, yeah, we have to let them go. But you're gonna come to Panama. I don't want to see you here in person, give you a big hug. And because we're like-minded, and like I said, the more of us, doctors, parents, nurse practitioners, professionals that know that the person comes first, that there's a cause, that we're not meant to suffer, right? That isn't just progression of aging or just the way it is, it's just your genes. We're not meant to suffer. And so what has to happen now is that there's this new movement. And let me tell you, it's a movement because there's many of us who are now really fighting for health. We have to know where it comes from. We have to always get down to the root cause and not just think a pill is going to take it away. And I don't want to diminish how powerful a pill could be, but a pill is
Sure.
never, if it's not to heal and it's just to cover, it's not enough, especially in the autism
No,
community. And there is no magic pill for autism. There's not a pill I could give my daughter which is going to make her talk.
right.
Do you know
There's
what I
no
mean?
magic pill for anything.
No magic pill for anything. So
Anything.
I invite everybody who's, you know, listening to this right now to follow Dr. E with the PhD. I'm going to put her Instagram, her TikTok, everything, her podcast, because she, even if not everything you talk about is autism, it's funny because then when I wrote to your assistant, I'm like, she's like, Miriam, but she's not an autism specialist. I'm like, she is though. She is though,
I'm like,
because here's the thing. What you are looking for is what I need somebody to look for in my child. What is wrong? Why are you manifesting these things?
why you mad?
There's
Yes.
gotta, why? What's going on? And so everything that you talked about is really opening our mind to so many possibilities in our own children. Even if you don't realize
Yeah.
that everything you say helps us, I know that it does. And that's why you're here today. And so I also want anybody who speaks English to understand that, yes, I have 84 different, you know, chapters of this, you know, Autism in my podcast. I am going to find a tool to dub them in English because they are in Spanish. I am working on it actively because I don't want people to just not have the information because they don't know the language. So for now,
Right.
I'm going to put subtitles, but I am finding a way. And so I don't want people to miss this information. And I thank you for being
Thank
here.
you.
And I know that you are just like me and that a diagnosis is not a prognosis, and that we have to fight for our health and for our right to be healthy. And anything else you want to say to close this up?
Don't give up. Don't give up. Keep searching for answers. They're out there, and there's a lot of people like us out here. Just find us.
Yep. And we will. We will, girlfriend. All right, guys. I thank all of you. We'll see you next time.